Lyme disease is often misunderstood, especially among seniors. Many people believe it's a simple condition, just the result of a tick bite, followed by a quick round of antibiotics, and then life returns to normal. But for older adults, the reality can be much more complicated, and at times, daunting. Beyond the initial infection, Lyme disease can linger, subtly eroding energy, causing persistent joint discomfort and even clouding mental clarity. For those over 65, these symptoms may masquerade as normal signs of aging, making the path to diagnosis and recovery more complex than most realize. At its core, Lyme disease is caused by the Borrelia burgdorferi bacterium, transmitted through the bite of an infected black-legged tick. Early symptoms often include fatigue, headaches, fever, muscle aches, and the hallmark bullseye rash. But for seniors, the picture is rarely this straightforward. Fatigue might be dismissed as part of getting older. Joint pain could be blamed on arthritis or old injuries. And when brain fog or memory lapses occur, they're often chalked up to the natural aging process. This overlap can delay a proper diagnosis, allowing Lyme disease to settle in and become a chronic, life-altering challenge. When Lyme disease is caught early, a carefully prescribed course of antibiotics is the gold standard of care. The Centers for Disease Control and Prevention recommend Doxycycline, typically 100 milligrams taken twice daily for 10 to 21 days. For those who can't tolerate doxycycline, which is not uncommon among seniors due to sensitivities or other medications, alternatives like amoxicillin or cefuroxime provide effective options. In cases where the infection has advanced and caused neurological or joint complications, intravenous antibiotics such as ceftriaxone may be necessary, often administered for up to a month. Clinical research supports the effectiveness of these treatments. The National Institutes of Health reports that 80 to 90% of early Lyme cases resolve with antibiotics. However, for about 10 to 20% of patients, especially seniors, symptoms may persist even after treatment. This lingering condition, called post-treatment Lyme disease syndrome, can include ongoing pain, fatigue, and cognitive difficulties. For these individuals, the journey doesn't end with the last antibiotic pill. Instead, it calls for a more comprehensive approach, blending medical treatments with natural remedies and thoughtful lifestyle changes. Natural remedies play a crucial role in easing the ongoing symptoms of Lyme disease, especially for older adults looking to regain energy and mobility. One of the most promising natural options is turmeric. The active compound, curcumin, is a powerful anti-inflammatory agent. Recent studies suggest that 500 milligrams of turmeric daily, especially when combined with black pepper to enhance absorption, can significantly reduce joint pain and stiffness. Another herbal ally is cat's claw, a traditional remedy known for its immune-boosting and pain-relieving properties. While some studies indicate it may help reduce discomfort, it's important for seniors to consult their healthcare provider before starting cat's claw, as it can interact with other medications. Astragalus, a root used in traditional Chinese medicine, is another supplement worth considering. It supports immune function and may help the body fight off lingering infections. A daily dose of 500 to 1,000 milligrams is commonly recommended, but again, only under the supervision of a healthcare professional. Probiotics are essential during and after antibiotic treatment, as antibiotics can disrupt the balance of healthy bacteria in the gut. A daily probiotic with 10 to 20 billion colony-forming units can help restore digestive health and bolster the immune system. For fatigue and muscle aches, common complaints among seniors with Lyme disease, magnesium and coenzyme Q10, CoQ10, offer additional support. Magnesium, taken at a dose of 200 to 400 milligrams daily, can help with muscle cramps and sleep quality. CoQ10, at 100 to 200 milligrams per day, supports cellular energy production and may help restore vitality. Perhaps the most powerful tool for seniors managing Lyme disease is diet. An anti-inflammatory approach to eating can dramatically reduce the burden of symptoms and support overall health. Prioritize foods rich in omega-3 fatty acids, such as wild-caught salmon and walnuts, as well as antioxidant-packed berries, leafy greens, and extra virgin olive oil. These ingredients work together to dampen inflammation and promote healing throughout the body. At the same time, it's wise to limit processed foods, added sugars, and potentially problematic foods like gluten or dairy, which some people find aggravate their symptoms. Incorporate immune-boosting foods like garlic, ginger, and shiitake mushrooms, which contain compounds known to support the body's defenses. Seniors should also pay special attention to protein intake, aiming for 1.2 to 1.6 grams per kilogram of body weight daily. For a 150-pound adult, that means about 82 to 110 grams of protein from sources like eggs, poultry, fish, or plant-based legumes. Hydration is equally important. Drink at least 8 to 10 cups of water or herbal tea throughout the day. And consider fermented foods like yogurt, kefir, or sauerkraut, which nourish the gut microbiome. Managing Lyme disease as a senior is a journey, best approached step by step. In the first 2 weeks, focus on antibiotic therapy as prescribed. Add a daily probiotic a few hours after antibiotics and try mixing turmeric into a morning smoothie. Begin transitioning to an anti-inflammatory diet with berries, nuts, and leafy greens. As you move into weeks 3 to 6, maintain these habits and add gentle movement, such as walking or yoga, 3 times a week. Introduce garlic and mushrooms into your meals and keep a journal to track symptoms and progress. From weeks 7 to 12, after antibiotic therapy is complete, consider adding immune-supportive herbs like cat's claw or astragalus with your doctor's approval. Increase your protein intake as needed and introduce short sessions of brain-stimulating activities, such as puzzles or reading to combat cognitive fog. Throughout this process, safety is paramount. Always consult your doctor before beginning new supplements or significant dietary changes, especially if you have kidney, liver, or heart conditions, or if you're taking multiple medications. If symptoms persist or worsen, don't hesitate to seek care from a Lyme specialist. Lyme disease does not have to define your golden years. With a foundation of medical treatment, complemented by natural remedies and a nourishing diet, it's possible to reclaim your energy, restore mental clarity, and enjoy life with renewed resilience. Take that first step today. One healthy meal, one supplement, one gentle walk at a time, and embrace the promise of thriving, not just surviving, despite Lyme disease.